Thank you for taking the time this evening to be part of our Let's Change Things period series. And today we are going to talk about something quite important, I believe. It's about talking about menstruation to your adolescent child. And happy Independence Day, all of you. I hope, this time, of course, many of us couldn't hoist flags and do the usual, but nonetheless, happy Independence Day. I am Shruti Harihara Subramanian, and I am the founder of Goli Soda. A little bit about Goli Soda. We started our store in 2013 as an independent store in Chennai. We are a brand that focuses completely on sustainable living. So anything that you require to lead a sustainable life, we hope we are providing that. So when we started in 2013, more out of a selfish need for myself to have access to eco-friendly products, we also realized that many people were still unaware of many eco-friendly and sustainable practices. So we realized that education in the space of sustainability was as important as having any of the products that help us to lead a sustainable life. So ever since then, Goli Soda has been actively having workshops and talks like these to open the eyes of the community about various sustainable practices and just let people know that, you know, you're not making a drastic lifestyle change, but yet you're making a big impact on the environment. So like many products that we have at Goli Soda, which I personally use, and only after I'm completely convinced that it's truly eco-friendly, we stock at our store. Eco Femme is one such product. Eco Femme is a cloth pad brand, and 10 years ago when I used it, it just changed my mind. It blew my mind away about the difference it made to me and the environment. Ever since then, we've been having a strong relationship with Eco Femme, and I hope it's only growing from now on. So of the many things that we have been doing with Eco Femme, Let's Change Things period is one such series that we've been doing the last few years. This year, of course, it's all gone virtual, and it's also given us the liberty to try doing different types of conversations around menstruation, not just about sustainable menstruation, but anything connected to menstrual health, we believe, is necessary to change the way society looks at menstruation itself. So today we have with us some very, very interesting speakers. I'd like to welcome all of you. I will introduce each one of you just before you speak, but I would like to introduce our first speaker, Dr. Uma. Dr. Uma Ram is an obstetric gynecologist at Sitapati Clinic and Hospital who aims to provide good evidence-based care with a human connect. She is keen on increasing health awareness in women so they make healthy choices. She is a Chennaiite who enjoys music, dance, reading, and travel. She is a chairperson for South India RCOG International Representative Committee. So welcome, Dr. Uma, and it's a great honor to have her here. I know how very, very busy she is. So having her here to talk about something very important and special for all of us is an honor for Goli Soda and Eco Femme. Before she starts, I hope most of you who are present here have taken the poll 1 so that the speakers have an idea of the demographic of the talk today, the audience today. So welcome, Dr. Uma. Over to you.
Thank you, Shruti. And I'm delighted to be part of this conversation. And thank also to all of you who have joined. I think what we all thought we'll do is take this phase of the hour through some small presentations from each of us, where, as Shruti said, we will give different aspects of the menstrual cycle and hygiene. And then, you know, you're open to take questions from all of you. So if there are questions, you may want to just enter it into the chat box, Shruti? So
yeah.
that um, we can take them in the end. Okay, so I hope you can see my screen. And yeah, I think it's important that this conversation happens, this conversation about puberty and about menstrual cycles, because it is a very significant and important life event in the lifetime of every girl, woman, where a significant change happens. And I thought I'd emphasize that while the first period, or the menstruation, is the most dramatic of the changes that happen with puberty as far as the girl is concerned, it is probably the last event in the sequence of changes that characterized puberty. So when a young girl is going through the hormonal changes and transforms into a young woman, those are the changes that happen during puberty. Typically, it begins with the ages of 9 to about 12 or 13. So, and puberty happens in boys as well. It's not as if puberty is, as you all know, puberty changes are common to boys and girls, but obviously the changes are slightly different. So the first change that happens with puberty is actually an increase in height, or what we call the growth spurt, after which there is breast development, and there is an increase or change in body hair, and you can actually see very fine hair developing in the axilla and in the pubic area, which then becomes thicker and curlier. There is a change in both body size and body shape. And the body, while there is a little bit of fat deposition, what is in a young girl a fairly straight body contour starts to develop. The curves with the hips becoming slightly wider, and a little bit of weight gain on the hips as well. There are some skin changes that happen, including the fact that the skin becomes oilier, and that is what causes that typical acne that happens. And finally, the period comes. So the reason I just put this up is it amazes me many times that even when women come to actually have their babies, sometimes they are not quite oriented to what is actually happening within their body. So fundamental as it is, in every woman and every girl and every woman, you have the uterus, which actually sits between the bladder and the bowel or the motion passage. So you have the uterus, which then opens into a vagina, which comes out, and between the bladder opening or the urethra and the motion passage. And the reason that we get our periods is because of the hormonal changes that happen around ovulation. So the two organs that are linked together, or the female reproductive system, you have the ovary and the uterus, and the ovarian changes, or the changes that happen in the ovary, have to be in sync with the changes that happen in the uterus. So the moment you have a girl who is born, a baby girl born, that baby girl has within her ovaries a set number of eggs or oocytes. And this is quite different from the boy, where the spermatogenesis or production of the sperms is a constant ongoing thing. It's not fixed. Whereas for us women, the number of eggs that are there in the ovary is a fixed fact, and we cannot increase it or change it. So around the time of around puberty, there is some hormonal changes that happen, where there is a hormonal changes that happen starting from the brain, and these hormones get connected to the ovary. And at the time of the first period is when actually ovulation happens. So with every ovulatory cycle, one of these eggs starts growing. It develops inside a fluid-filled space that we call the follicle. the follicle then bursts open, and the egg, which is microscopic and which we cannot see, gets released. And then there are other changes that happen in the ovary with the production of what is called the corpus luteum. So what happens is, when the during a period, it is the lining of the uterus that is shed, and the amount of the bleeding that happens is associated with the thickness of the lining of the uterus. So when the lining of the uterus is completely shed with the period, the lining of the uterus is completely thinned out, what we call the endometrium. This is the time when one of the small eggs starts growing. And as that egg starts growing, there is the production of estrogen from the ovary. That estrogen acts on the lining of the uterus and starts thickening the lining of the uterus. And then you have ovulation happening, where the egg gets released, and then a hormone called progesterone is produced in the ovary. That progesterone then results in further thickening of the lining of the uterus. Now, why is all this change happening? This is happening in a beautifully orchestrated fashion, because eventually the uterus is preparing for receiving a fertilized egg. So when a pregnancy is likely to happen, the sperm and the egg meet, an embryo is formed, and that potential baby is able to grow within this lining of the uterus. That's the purpose for which this happens. Obviously, that's going to happen at a certain point in time, much later in this girl's life, but the process has already started. So therefore, when there isn't a pregnancy that implants into the lining of the uterus, and therefore, and without which the normal estrogen and progesterone, which have increased, drop, there is no hormone there to sustain this lining to stay on the uterus, and therefore that tissue comes out as a period. So this is the sequence of events that happen, which result in the menstrual cycle. So, we call it a period simply because it's a length of time. This length of time is typically believed to, most people, we assume it's a 28-day cycle, and it will be a 28-day cycle if ovulation happens on day 14. The time between the release of the egg or ovulation and the actual onset of the period is usually a fixed 14 days. What is variable is the first phase, what we call the follicular phase, where there is a change. So if the egg formation, instead of happening on day 14, the release of the egg happens on day 16, then you will have a 30-day period. And if ovulation is not happening on time, then the period gets erratic, and you can get irregular periods once in 40 days or 45 days, because this ovulation is either not happening at all or happening in a delayed fashion. And in the first year to a year and a half of a young girl's life, the body is still kind of getting used to this ovulatory cycle, and therefore it is very normal to have what we call anovulatory cycles, where this release of the egg is not happening like clockwork, and therefore irregularity or delay in the cycles is very, very common in adolescence. So, as I said, menarche, which is the first period, tends to happen between age 10 to 12. Usually it happens once in every 28 to 30 days, and we count day 1 as the first day of flow. Traditionally, most women, now it is changing, of course, but traditionally most women would count day 4 as their day 1. But it's important that when you communicate, at least with a doctor, that you're using day 1 as the first day of flow. So there can be, as I said, a variation in the cycle pattern. So if somebody is used to having 32-day, 35-day cycles, that's not abnormal. And if the duration of bleeding could vary from anywhere from 2 days to 7 days. What may be heavy, normal for me, may be heavy for somebody else. So you have to get used to what is normal for you. And as I said, initial cycles may be irregular, and then it becomes regular. So when should somebody, what are the flags for you to seek help? Anybody, so if puberty happens very early or very late, both are reasons to seek help. So if you get a period, if the child gets a period before the age of 10, definitely before the age of 9, then you need to seek help. But for the parents in the audience, what you need to look out for is if the earlier changes of puberty are starting to happen early. So if the growth spurt is happening by age 7 or 8, that means the puberty process is setting in early. And that is something that you need, or you start seeing breast budding even at 7.5 or 8, then definitely something is not okay. If you don't get a period by age 16, for sure, you need to seek help. If the cycles are very erratic or very painful or heavy, then you need to seek help. I just want to, kind of wind up by saying that obviously, while it might be a very fundamental fact, period cycles are normal. It's a normal physiological process. A lot of, what shall I say, emotion is attached to a period. A lot of cultural activities are associated with the period. A lot of us worry about it far more than we need to. It's a normal physiological process. Women can do most things during a period. Certainly we can exercise during a period, and that's a very common query that comes from parents, and maybe we can discuss that a little bit later. It's very important that both the parents and the young child or the adolescent focus on nutrition. And this I say specifically because today there are a lot of food fads, and you find that calcium supplementation and iron supplementation may not be happening adequately. And it's very important, especially for calcium, to be deposited at this stage of puberty, because as I said, increase in height is happening. And how does height increase? Because your bones are growing. What are our bones made of? Calcium. So unless there is adequate calcium in the diet, your bones are not going to be strong. And as I said, we'll discuss the importance of exercise. So I think I'm kind of just touched upon what is normal physiology, what are the things that we need to have a red flag about. And it's important for us to understand this as parents so that we can communicate it to the children, and so that they are prepared to expect what it is when they actually start going through puberty and get their first menstrual cycle. So I think, Shruti, I'll stop here and then return back to you.
Okay. Thank you so much, Dr. Uma. I'm sure there'll be a lot of questions targeted to you after, soon at the end. So we'll get back to you very soon. So before we go to Kalvi, who is our next speaker, we'd like all our audience to take the second poll, please, just to understand again how much you know about the menstrual hygiene products in the market and other questions related to that. Meanwhile, as you take this poll, I would like to introduce Kalvi, who will be talking to us about the various menstrual hygiene products available in the market. Because unlike before, right now, a girl has many choices, and we believe for her comfort and for her convenience, she needs to finally make the choice. And nothing like having an informed choice, knowing all the options available. And you'll know why. We'll be coming to our next speaker as well, who had made her own choice on what product to use. So introducing Kalvi to all of you. She, after completing her master's degree, Kalvi realized that she wanted to work towards creating a positive impact on society and the environment, which is what brought her to Eco Femme. Today, she is the key facilitator and educator for the Pad for Pad program, where she educates girls on how to manage their periods hygienically and with dignity, along with the chance to relate to menstruation as a normal, healthy experience. And let me tell you, Kalvi has worked with a number of girls around Pondicherry, Oroville, and other areas as well. So she almost understands the psychology of young girls, and she's great at getting the topic across to them. And before I pass it on to Kalvi, just a reminder once again to the audience, feel free to type in your any questions that you have for any of our speakers in the chat box, and we'll be happy for them to answer your questions. So over to you, Kalvi.
Thank you, Shruti. Can you hear me?
Yes,
Yeah.
please.
Thank you. Today I will be putting a presentation on different menstrual products that is available in today's market. The reason why I'm putting this presentation is that the choice need to be informed. It need to be made by knowing the product very well. Can we start with the presentation?
Yeah, just 1 second.
So let me give you an introduction that in today's market, there are various menstrual products that is available. So they are such as disposable product, uh, which can be Stay Free, Whisper, or Sophie, any kind of these products, and also reusable cloth pads and tampons, as well as menstrual cup. And there are also period panties and other products that are available. So when we talk about a product, we need to consider the health impact, the environmental impact, cost and comfort and cultural impact a product creates. So let's start by talking about disposable pad. So one single disposable pad is equivalent to 4 plastic bags. And the next slide is about what the pad is made out of. So the pad is made out of 90% plastic, and the pad looks white because it is bleached using cellulose wood. And yeah, next slides. So these are the chemicals that is present inside the pad, disposable pad, which is acetone, chloromethane, chlorothane, and which releases dioxin. And you can see this, like these products, these chemicals are used to make the car tire and nail polish remover. Yeah. So this, 1 second. So the reason why the tampon and disposable products are white is because they are bleached, and the bleaching requires a chemical called chlorine, which releases harmful dioxins. And also the pads are made out of pesticides. And when we consider this regarding our health, it creates harmful effect, which is really frightening. So it creates cancer indirectly, and it interrupts our hormone, and it also creates allergic reaction like itching and rashes. So the girls and women, they don't feel open to talk about it freely. Yeah. And similar to the disposable pad, a tampon is an internal product which is worn inside the vagina, and it is, yeah, so this is the way how a tampon is used. So it is inserted in the vagina, and the disposable pad and tampon is a single time use product. So after using the disposable product, and what happens environmentally? Does it disappear? It creates so much waste, and a disposable pad takes 500 to 800 years to get decomposed. So if you can imagine, we won't live that long. Even our generations would fade away. So this is really frightening. And so where is the way? If you throw the pads out of your house, where does it goes? And if you can think where all your pads are surrounding. And after using a disposable pad, we should never flush it in our toilet, because of the chemicals that is present in our pad. It bloats the pad and it will block the pipeline. And if you burn the pad, it releases harmful reaction. So it releases dioxin, which is very, very harmful to the environment and as well as for the human. Menstrual waste. In India, there are 355 million of women who are at menstruating age, and around 50% of women in India are using disposable products. And it creates 9,000 tons of sanitary waste every year. So it's like 90% as heavy as Eiffel Tower. So what can be other option? So washable cloth pad. So the washable cloth pads can be used, a single pad can be used for 5 years, a period of 5 years. It can be reused for 75 washes, and it is made out of organic cotton, which has a thin laminated PUL layer behind the pad, which prevents us from leakaging. And the pads are the pads can be washed in cold water, shouldn't it be washed in hot water, and it is healthy for our body and healthy for our environment. And the only thing the pad has a disadvantage is that we have to wash it. And yeah, and if you have a question if the pad, reusable pad, is hygienic, it is perfectly hygienic if it is washed properly and dried under the sun. And menstrual cup, reusable menstrual cup. There are many menstrual cups is available in today's market, and one single menstrual cup lasts for a period of 10 years, and it's made out of medically graded silicone, and it has no bad impact towards our health, and it's an internal product. Yeah, so this is how a cup is used. It is folded and inserted into our vagina. It can be used for a period of 8 hours. As doctor has mentioned earlier in our slide, we have 3 openings. So vagina is a different opening, which we get our menstruation, and we pee using other opening, which is our urethra. And there are other alternatives for menstrual products, which are biodegradable pads and organic tampons. And there are also period panties that are emerging nowadays. So when we make a choice of what product we should use, we should consider if it is healthy, if it is comfortable for us, and what is the cost, and what kind of impact that it creates environmentally and culturally.
Okay.
Yeah, thank you.
Kalvi. I think it was very informative because especially during my times, I think we were only given the disposable pad as an option. We had, I mean, it was just understood you have to use this and that's it. And they thought that was actually giving us more freedom from the foldable cloths that our mothers used to use. But for me, then it became a reverse shift when I got to know about the cloth pad. Initially, I was hesitant with all the mind blocks that we grew up with. And then having used the disposable from the day one of my first period, when we shifted to the cloth pad, it was like, oh my God, I never knew comfort was something like this. So, but of course, it takes a while for any new things for anybody to get used to, because menstruation itself for a young girl is everything's new about it, how she's being viewed by her friends or family when she has it. And especially in India, there are a lot of cultural things associated with it. So that's why I'm thankful for all of you to be here to talk to us through all these things. I'm sure there are already questions coming in. There will be a lot more. So please be prepared for those. Let us now move on to the mother-daughter duo, Upasana and Ritu. They will be talking about their whole personal experience being a mother-daughter, how Upasana brought up the subject to Ritu, and how Ritu took decided to make her choice of what she felt was right for her body. So let me introduce them. We are very happy to have them here. They are from Gurgaon. Ritu Luthra is a student of class 11 and an Eco Femme ambassador and cloth pad user. Upasana Mahatani Luthra is the director of the Gurgaon Moms Club, as well as their events and mom influencer program. So welcome Upasana, Ritu, over to you.
Thank you, Shruti, for that introduction.
Thank you so much, Shruti. Go ahead.
So, I'm just starting from the beginning of me realizing periods. So when I was about 7, there used to be this ad on TV for Whisper All Night pads. And I just looked at them. There's this blue liquid pouring. This girl is sleeping through the night. And I was just like, I'm never going to be one of those lazy women who try to wear diapers to bed because they're so lazy they don't want to go to the washroom in the night. Because I thought it was pee, because why are we using blue liquid for blood? Anyways, so I asked my mother later on when I realized that women aren't wearing diapers to bed, that what are whisper pads? And I was about 8 at this time. And then somewhere in the car, I think, she started the conversation. Do you want to talk about how that went?
So one thing I would say is I was very upfront with her. I didn't hide the facts. I told her what was age appropriate for her, because my own mother told me a story which I still can't get over about periods and why they happen. So I told her in as, simple terms as possible. I guess in those days we didn't have so many tools on the internet. So about the physiological happenings, and it's very natural, and that if she ever sees blood, that she should come to me immediately. Go ahead, then what happened?
So cut to 2 years later, I'm 10, and we were at my grandmother's house, and we'd just come back from dinner. I was changing, and I saw blood in my underwear. And I was like, oh, I think I just got my period. What should I do? So I called out for her, and she said, it's a bit early in life, but I think you've started your period. And she wasn't carrying any menstrual products on that trip, so we had to go borrow it from my cousin. She's the one who taught me how to wear a pad, and it was a non-reusable plastic sanitary napkin. That was my first introduction to a period product. I had known how it looked like and how to wear it roughly. And then about almost exactly 4 years later, I was in Auroville and I saw a poster which, if you remember Kalri's presentation, there's an image of dogs gnawing at sanitary napkins, and that irked me completely. I was like, ugh, I don't want to use sanitary napkins anymore. And it was an Eco Femme poster. So I looked up Eco Femme later on in the day when I got back home. And I started exploring the pros and cons of cloth pads. I was a bit iffy. I had no idea such a thing even existed. I was always passionate about the environment. So that was my first outlook, that firstly, dogs aren't chewing at these cloth pads. And then I realized how harmful sanitary napkins really are, the dioxins present in them, the kind of harmful impacts they can have on menstrual health. And so I brought up the conversation with my mother. First, I prepared facts about how to approach it, why I think it's very important because of the environment. And secondly, weirdly for me, it was that first the environment, then it's also, oh, my reproductive health is at stake after using these pads filled with dioxins and plastics. So now my mom will share her reaction to me bringing up this conversation.
So my first reaction was no. Because I guess we are so conditioned to thinking that cloth is dirty and cloth cannot never be hygienic. And growing up, we've always been told that, no, don't use, be careful. You should be very hygienic and clean, especially in the genital area. Of course, we wouldn't talk about even this word genital in front of our parents. So then I slowly listened to her, and we took a trip to Madras. We went again to Auroville. We saw the Eco Femme production. I saw how many and what kind of people were involved in the production. And I saw how passionate she was about it. So I gave her a timeline saying that, okay, you try it for maybe 1 or 2 months. But if there's any effect on your health, it comes to an immediate stop. My main priority was that her health should not be affected. So that's how we started our journey, her journey rather, with cloth pads. And I'm very proud to say that Nitu has always handled everything herself. It's not as though, as her mom, I sat and washed her pads. I've literally never done it. She's been independent about it, and she's always done that.
Yeah.
So that's how it is. I also want to add that I have a son as well, and we've never shied away from being upfront. Especially, I think Nitu is the one who actually tells him that this is my pad. If he's asked, what is this? Or, if she's asked him to pass it to her, she says, Nanak, this is my pad. He's a special needs boy, so there's not a lot we can be upfront about. But we've not explained to him exactly about the periods, but again, we've not shied away about it. You want to add something?
I'm good.
Okay.
Okay. Thank you so much, Upasana and Ritu. Again, I'm sure there'll be many parents here in our audience who would like to talk to Upasana about how anything to do, either with cloth pads or even about bringing up a topic, because some parents still, I believe, the whole reason why we are having this talk is even in this day and age, there are still many parents who feel shy to bring up a topic like this in front of their the girls or even their boys, because we also believe the boys at home should understand what the girl goes through, because most of the girls are now studying in co-ed schools, and it's something the boys are going to face definitely at some point later in life with their partners. So I'm sure the questions will definitely come to you as well. So let's start taking some of the questions that's already come to us. The first one is to Dr. Uma from Anuradha. She asks, how safe is a menstrual cup for a young girl? Does it also cause the toxic shock syndrome as it is internal? How about maintenance? What are the points to be careful on?
Okay. So how safe is a menstrual cup? In general, the menstrual cup is quite safe. It does not cause toxic shock syndrome because I'll explain. Yeah. So toxic shock syndrome is a complication that can happen and has been known to happen with the use of tampons. However, I must say that it's not a very common complication. It usually happens if the tampon is left inside and then you forget about it, or you forget to change it for a long period of time. Then it can, the toxins get absorbed and you can get a toxic shock syndrome, which can be fairly, serious. So because the menstrual cup does not have any of the, anything other than silicone, hospital grade silicone, medical grade silicone, and there are no other plastic substances inside, then it's essentially just a cup that is collecting the blood, which you can then discard. It does not cause toxic shock syndrome. But again, but 2 points that I want to say is, for a young adolescent girl, both the use of a tampon or a menstrual cup may be difficult simply because it has to be inserted into the vagina. So while they are, when they're tiny, obviously because the hymen is still not broken, and they may not be comfortable with the idea of insertion, it may not be the ideal choice for somebody in the initial years of their puberty and menarche. Older girls, yes, a lot of them are switching to the menstrual cup. Young women are switching to the menstrual cup simply because it is convenient. And but you must remember that in 6 to 8 hours, you will have to remove it and clean it. And I have had, calls saying, what do we do? We are now on the road. We have to go into a public toilet. Can I just wash it in the sink and reinsert it? So you need to just plan these things because practically it's an issue. You suddenly wonder, is it safe for me to just wash it in the sink and then insert it again? So you have to be good about cleaning the cup, and then you can reuse.
But Dr. Uma, there's also a lot of discussion on, some say unless you're sexually active, you can't use it. Some say it's still okay if you're not sexually active. So there is a lot of can or cannot with the menstrual cup and probably even the tampon. So what is your say on that? Of course, it has to do with the hymen, but still.
Yeah, so like I said, it is to do with the fact that you must be comfortable with insertion of and the both the tampon, the smaller tampons, and the cup. Actually, the cup is quite pliable. It can be folded and inserted quite easily once you get the hang of it. But again, obviously, as I said before, if the hymen is still intact, if you're not comfortable with the idea of insertion, it will be difficult. Now, the common misconception is that one has to be sexually active for the hymen to be broken. That is, again, not necessarily true. You could be in sports, you could be running, you could just do a split when you're exercising or in yoga, and the hymen could still break. So you don't have to have sexual activity for the hymen to break. So as long as you're comfortable, it can still be inserted. I don't know if Kalvi wants to add something here at this point.
I would like to add the cleaning instruction.
Yeah.
So after using a menstrual cup, we need to sterilize it, like boil it in hot water to clean it and keep it for the next period. And yeah, in between, like for example, if my period is for 5 days, you can use the cup for 5 days and sterilize it at the last day of your period and keep it for the next period.
Yeah. So the question about can somebody use it at age 10 or 12? Probably not, because it's not going to be convenient, is my take.
Also, we need to consider the cultural aspect here. Yeah, it depends upon the parents. You can have a discussion with your parents how they feel about it, and yeah.
Can you elaborate on the cultural aspect?
For example, like I am from Tamil Nadu, so here inserting a product inside the vagina is not practiced. Any kind of product. We are used to use a piece of cloth or disposable pad or a reusable pad, cloth pad. And to show, like when I do session, when I talk about the cup or tampon, the girls, they really giggle and they laugh and they feel surprised to see such products. So it's not a well-known product in the rural area. Maybe in the cities it's well-known, but still, like I would ask them to have a conversation with their parents or with their friends to make them how they feel.
Yeah, I just want to add, it's not just young girls. I mean, there are not necessarily menstrual hygiene products, but there are contraceptives which you can insert vaginally. Vaginal rings are some of the most common contraceptive in the Western world. It just doesn't sell in India because even after they have their babies, women are just not comfortable with the idea of inserting something into the vagina and removing it. So to that extent, it is a cultural thing. It is in our heads. We are not comfortable, and therefore it doesn't happen. But it's also, I think, a generational thing. I do see a lot of the younger generation switch to using the cup very comfortably.
Yeah.
So,
thank you. Over to another question. This is for Upasana. From Shobana. How did you open this topic about menstrual cycle and about pads to your son? My 10-year-old son is curious to know about it as he watches advertisements on televisions on knowing what is it all about. Please throw light on that.
Thank you, Shobana. Thank you for joining in. I'll let Nitu answer first and then I'll add to it.
So a couple of years ago, my brother was washing me brush my teeth, because what is personal space? And I was on my period and my pads were soaking, and the water was full of blood. So that's what he saw, and he was like, "Where did you get hurt? Like, there is so much blood. Are you okay?" So I was like, "Yeah, Nanak, sometimes girls, they bleed without getting hurt. And Nanak isn't a neurotypically developing boy. He has Asperger's syndrome. So I think that was about an appropriate um, way to explain periods to him. However, we do not think this is an appropriate way for everyone. So how would you have approached that with a neurotypical boy?
So I would recommend definitely tell them to their age appropriate, be upfront. And you can probably tell them that, Amma also gets her periods. That's why we have these products at home. And that line, I think, is a great line, that sometimes women or girls bleed without getting hurt. So you can tell them that it may hurt my back or I may get a headache, but that doesn't mean I'm wounded. So it would be nice to just explain that it's a very normal process, and eventually this is the reason this leads to us having babies and pregnancy. That's a shortcut. I'm sure there are lots of videos and books available these days that can easily explain it to everyone. I think there's one more question, Shruti, for Nitu.
Yeah. So, yeah, Ritu, even I was meaning to ask you, but before I ask that question, I wanted to add one other point to Shobana. So we had another speaker on our previous panel who is an Eco Femme cloth pad user. She's a single mom, and so she has to share her house in the bathroom with her, again, 10-year-old son. So though she recently shifted to the cloth pad, what was stopping her was actually, okay, if I have to wash my pad, what will I tell my son? But finally, she took the courage, she sat down and him, because he was old enough to understand, many of his class friends must be starting to have their periods. She actually told straight in his face enough to know what the whole process is about, and he accepted it quite well. And because every day, every once a month when she's going to wash her pad, he needs to know what is happening if they're sharing the bathroom. Her concern was that, and she said her son took it beautifully, and it made her feel more comfortable about shifting to the cloth pad. So you would know, I think, I also feel, if you understand the maturity of your son or his peer group and the girls in his batch, I think whatever is right to expose the right information, I think it will make things easier for all at home, I believe. Because even fathers need to, I think, be also involved, is my belief. Because if especially if you're doing cloth pads and if you're washing it at home, unlike before where it's all about hush hush, and even if a sanitary pad, disposable one, is bought in a black plastic cover, I think the whole idea of these conversations are to make sure those changes are being made first at home and eventually in the society. But Ritu,
sorry, Shruti, can I just add here?
Yes.
We've done Pan India, we've done a lot of, obviously different doctors, but we've done a lot of school education, school sessions with adolescent, typically class 6, 7, 8, talking about normal menstrual cycle. And in many of the schools, we actually have requested, can we do this for the boys as well? But unfortunately, schools are not open to the idea. They just say, come and do it for the girls. But I think it's extremely important that boys understand and know, because it's part of life that they're going to have to deal with. And if they understand it, they probably will react in an appropriate fashion. And also, some of the issues that girls face in schools is with toilets and how to dispose stuff, and those are again some queries that come up. So I would encourage everybody to actually talk to their kids, irrespective whether they're boys or girls. And you can equally tell the boy about the pubertal changes that he's going through as well.
which is actually probably neglected far more because I don't think they have a D-Day unlike the girls. So, I guess they also should know what's happening. Well said, Dr. Uma. The other question, again, while we are talking about boys and co-education, I think, Ritu, this question would be appropriate to ask you right now. How does your peer group react to you when you say you're using a cloth pad, or do you discuss about this in your circles? And how do you discuss? And there is a common question when it comes to cloth pad. How can I change it when I go to school? They assume that a cloth pad has to be washed immediately. They don't understand it can be brought home. So if you could tell us about that and your discussions in your peer groups.
Sorry, that was one of my main concerns also.
Yeah.
What will you do in school?
So when we actually had physical school, it was about a 9-hour period out of the house. But duration of the day out of the house. So I would wear my pad at about 8, and then we had lunch break at about 1. So right before lunch break, I would change my pad, keep it in a cloth pouch in my backpack.
I know you have a cloth pad with you. Could you show how you fold it?
So this is the side the blood goes on. There's 2 wings here, right? So just like this and like this, and it should fit easily in any small cloth pouch, which I just kept in a separate section of my bag so that it's away from the books. And yeah, so that's what I used to do. And the first time I did that, I took it in my hand, the pouch with the new pad in it, and then I came back with the same pouch with the old pad in it. So one of my classmates was like, why didn't you throw your pad away? Why have you brought it back? And I was like, oh, I started this new thing over the summer. I'm using cloth pads now. And so that became a conversation in my girl peer group that I'm using these cloth pads now. You should use them. They're so comfortable, and you know they're good for the environment too. And apparently they're good for you too. And then after I started as an Eco Femme ambassador, obviously I had to tell my closest guy friends. And in our school, for some reason, the boys are just much more open to talking about menstruation, at least in my grade, than the girls were. So the boys actually became my period buddies. They're the ones who would check me for stains. I would talk very openly. Oh, you know, this article is coming out on Eco Femme. I'm so excited. And my work as an ambassador, I would share with them more than probably my girlfriends who were shyer to talk about menstruation. So yeah, that's how the peer.
Very well put, Ritu. And I think a lot, I see this confidence and the passion you have about this topic. A lot of credit definitely has to go to Upasana for, standing by her and encouraging, and the credit has to go a lot to the mother as well to support her in what she believes in. So thank you, Upasana, for that as well.
My pleasure, Shruti. I think there's one more question though.
Yeah, it's to you, Upasana and Rita, about the holding capacity and the rate of absorption of the cloth pad. Wouldn't they leak? That's a question which I'm sure even Kyle can answer that as well. But
I actually have an open cloth pad. So what you see here is a cloth pad that's been stitched. This is not stitched. So this is the bottom layer of the pad. It's just normal cotton, but there's a PUL lining over here. So you can see it's sort of shiny. That's slight plastic, a very fine layer, but this makes it leak proof. And now based on the size of the pad, so there's a day pad plus, there's a day pad, there's a night pad, there's more layers of these cotton, organic cotton layers. So in the largest pad, there are about 8, and in the smaller pads, there are 5 to 6. So all your blood would go first through this layer, then through all these layers, and finally it would settle here. So it is pretty leak proof. And the only time I've had stains would be like when I moved in a certain position and the blood fell where there wasn't a pad or something like that. But otherwise, I've had a very positive experience with no leaks. Especially during the night, I'm much more comfortable with using cloth pads. There are no leaks. I've not really experienced that too much. I would say initially, while you're getting used to it, yes, there may be leaks, but I feel like it's sort of like learning again. Like initially when you started your period with disposable pads, maybe you also had a lot of leaks. So it's just different to see like, oh, my cycle is like this, so maybe if I used a pad with 8 layers today, it would be more beneficial than if I used one with 6 layers on my heaviest day of flow. So it's a learning process, but it's a very easy learning process.
Just add to that, from my personal experience, I always tell people to, if you want to shift to the cloth pad, do it on a low flow day or when you're at home, so you understand your flow or what kind of pad suits your body better. And
Can
yeah,
I add some more
yes, please
information?
do.
Okay, so before using a cloth pad, it needs to be washed for a better absorption. And there are 5 kinds of pads that are available at Eco Femme. So it's panty liner with PUL and without PUL, and day pad plus, night pad, as well as there is a pad called foldable pad. So how to choose your,
Well, just
that's a foldable pad.
comes here and you could just fold it. These are easier to dry as well.
Yeah. So
Sorry.
yeah, sorry. How to choose your pad? For example, if you're having a very heavy flow, we would recommend you to choose foldable pad or night pad, because it has 8 layers of flannels, as Neetu has already explained. And if your flow is medium or a normal flow, I would recommend to go for day pad plus and day pad. And on your last days, when there are like few drops of blood, then you can use your panty liner.
And the other advantage I've seen with the cloth pad is that actually I've had less accidents than a disposable, because you feel more connected with your body and you understand your flow better with a cloth pad. So you know exactly when to change, as opposed to a disposable pad where sometimes you don't realize that you've been bleeding so much and then it overflows, and you have more accidents that way. So let me move on to the next question to Dr. Uma. Somebody's asked here, Divya Vishwanathan, what are the signs that a child is going to attain puberty? Can a pediatrician help with guiding in this regard? I think you had explained it quite well in your slide as well, but
I think, hi Divya. I think the changes that happen, as I mentioned in my talk, is the first sign is growth spurt. So there's an increase in height, and then there's breast budding, and then you notice other changes. So there's a change in the body size, there's a change in the body shape. Typically the body gets a little bit more curved, and then you notice an increase in or parallelly you notice onset of hair, both in the axilla and in the pubic area. And then the last bit is when you get the menstrual cycle. So as a parent, when your child, and you will notice this in schools actually, when you see in class 6 and 7, the girls will be taller than the boys, because for girls the puberty kicks in earlier. But the boys, the puberty kicks in later and lasts a little bit longer. So the concern with somebody getting very early puberty is that initially they'll be taller than the class, but when their puberty stops and their period starts, actually what is happening parallelly is that their bone growth is stopping at that point. So the ultimate height that is achieved will be lower. So that's the reason why we say when they start their pubertal changes at 7 or 8, you need to approach your pediatrician. But if you start seeing this around 8.5, 9, today it is considered normal because a lot of kids are getting their period around 9.5, 10. I hope that answers the question.
There's one more question to Dr. Uma. Do you recommend a visit to the doctor at the onset of puberty for an overall health check?
Not routinely, no. It's not necessary as long as the child is doing well, because you would have had a pediatrician look at basic things anyway. So as long as there's that there is no anemia, we're seeing a lot of children with anemia, irrespective of what social class they come from. So that's something that we need to keep on track. Because definitely when they then start bleeding, there is a monthly loss of blood, and therefore enough iron in your diet to replace that loss. So as long as there's no anemia, and as long as their cycles are not terribly erratic, there is no routine need to go to a doctor to just check that everything is okay.
So, but Dr. Uma, you had mentioned that initial few cycles will be irregular for the girl.
Yeah.
But at which point do you know it's really irregular, needs attention?
So the first few, so it takes time for, as I said, for this whole hormonal cycle to fall into place. So it's very common to, let's say, get one period and then not have a period for 2-3 months, or have 2 quick periods and then no period for a couple of months and then a period again. When would you worry if the child is bleeding like every 15 days? Or if the period goes on for longer than a week each time and the flow is heavy, or there isn't a period for more than 6-7 months, right? So those are situations where you need to check, and the commonest thing we would check at that time is for anemia and thyroid.
Okay. A question I have for Kyle, since you work with a lot of children and you bring up this topic of menstruation and adolescence and puberty. In this day and age, of course, it's very different from a time that I come from, or probably where Upasana's come from. I mean, we all come from different generations, but in this generation where there's a lot of content available online, and as most of us now get to understand period for the first time through ads, when you talk to these girls, what are the kind of misinformation or wrong information they come with, or are they misguided? What has been your experience with that, and how important is it for them to talk to an expert like you or Dr. Uma or somebody like that? So how do you bring about that subject?
So basically, I do session with girls who goes to, like, who are from rural areas. So I can share my experience from there. They have misconception regarding vaginal discharge. They always mention in my session that they get vaginal discharge because they are weak, or like their body is not healthy. So this is something. And the secondly, they have so many myths and taboos their parents tell them, and they are like, they follow that. So we create a scenario to make them think critically, you know. Yeah. For example, they say that during your period you should not dry your cloth pad or cloth outside. If a snake or if a man sees your pad, you will become infertile. So these kind of misconception and myth they tend to believe. So we create a scenario by playing games to make them think critically.
Okay.
I think that's extremely, what shall I say, need of the hour, because there are, even in the metros, I think there are a lot of myths about the period. And I can imagine that in a rural area, definitely the belief systems, it may have just come from the fact that if the pad is dried out, people are by the side will know that somebody is having a period here. That may have been the logic with which these kind of things have started. But the white discharge thing is very prevalent. lot of people believe that the white discharge that melts them away, and they blame all their exhaustion and tiredness on it. But vaginal discharge is normal. It's common. I always say it's like sweating. Just like some people sweat more, some people sweat less. So it's not an issue. And interestingly, many times actually the girl herself won't be concerned. It's the mother's anxiety that brings her to the doctor, and that anxiety then can easily get transferred. So it's important. I mean, as a parent, obviously you have concerns, but I think we need to be conscious about how much of that concern we we convert into anxiety and transfer to the next generation. That we should avoid. If we have concern and anxiety, we clarify it ourselves so that we are reassured and we provide the reassurance to the next generation. I think that should be the way to handle this.
Yeah.
So Upasana would agree to that. Because we have Ritu as an example there. But Dr. Ma, could you explain a little bit more quickly, because we're running out of time, about this white discharge itself? Because as Kalvi said, there are a lot of questions revolving around it. When does a girl start having this white discharge? Again, when should the parents be worried about it or not be worried at all?
So the discharge is basically secretions that come from the mouth of the uterus or the cervix and the vaginal lining. So any gland, so just like you have saliva coming from inside your cheek and mouth lining, there is some secretion that comes out of the vagina and out of the cervix, and that's what usually comes out as discharge. And I said the quantity varies. Typically during the menstrual cycle, you will notice that the discharge is most around ovulation, because the mucus or the secretion from the cervix tends to thin. The purpose of this thinning, of course, is for later in life, when during ovulation, you want things to be conducive for the sperm to be able to negotiate the cervix and go into the uterus to achieve fertilization. So that is the reason there are certain times, especially around ovulation, that the discharge becomes more. Similarly, there can be discharge just before and after a period. These are normal levels of discharge. You don't have to worry about it. It is extremely unlikely that a young girl who's not yet sexually active can pick up an infection. And therefore, most of the time, you don't have to worry about discharge. What happens is, in a country, in a situation where the weather is like the weather in Chennai, for example, which is hot and humid, and there is discharge, at times when there's a vaginal discharge, this child or young girl is in school or college, the panty gets wet. That is what results in chafing the skin and causing some itching or irritation. So the only advice I've tended to give to young girls who have a lot of discharge, which can be normal, is it's normal, you have to deal with it. You can use like a liner and keep a couple of liners with you when you go to school or college, and then dispose it off so that the panty is always dry. Then you won't have the chafing of skin, you won't have the irritation or the smell.
You have even reusable panty liners as well.
Yeah, I just heard actually that. I didn't know. Now I can advise that. So that is available.
That is good for even older women who have incontinence. Many women seem to be using the panty liners for that as well. Again, talking about the white discharge.
Can I add something on top of it, like what I tell to the girls?
Sure.
Yeah, so I tell the girls when to seek help regarding white discharge. I say that when the discharge is more itching and when you get rashes, then I advise them to meet with a doctor. And when they get excess amount of discharge, that their clothes get wet. And then when their discharge is yellowish in color or greenish in color. So these are the couple of points. Hello?
Bad odor, one of the...
Yeah, bad smell, fishy smell. Then I advise the girls to meet with the doctor. And yeah, we also tell them that the discharge starts before, like during their puberty. And we show them, if the girls are in 12th grade, we show them the different ways how a discharge looks like for comparing it with the different phases of the menstrual cycle. So after period, it looks like a transparent water, and then it thickens and it's like eggs white, and then it becomes creamy. So we give such kind of example for them to relate to with their body.
Okay. Thank you. And Dr. Uma, there's one more question related to this white discharge. Somebody is asking, is continuous white discharge harmful?
Like I said, discharge per se is not harmful. There are some young girls and women who have more vaginal discharge than others, and it may cause a wetting of their panty. As long as there is no itching, irritation, there are no signs of infection, and the other flags that we just mentioned, I don't think we need to worry.
And Dr. Uma, Shobana wants to know her.
Yeah, I've answered that. I've answered that in the chat box.
Oh, great. So I think we can wrap it up. We've run out of time. I think it was a really informative and interactive session. Thank you, speakers, once again for taking the time. And thank you, audience, for participating. I hope you spread the word. I hope this talk has been very useful for you or your children or for your friends. And do spread the word. And if you have further doubts or any other clarification, please feel free to contact either Eco Femme or Goli Soda on our social media pages. And we'll be happy to clarify any doubts with regards to anything, even if you want more information on cloth pads or menstrual cups, about the maintenance or how to wash them, because there's so much that we can go into each of the subject. We've just touched upon everything due to time constraints, but we are here to help you. As we told you, Goli Soda is here to educate and help you with all your doubts and clarifications. Thank you so much, everybody, for your time. And Dr. Uma, there's one just question about blood clots. Do you want to quickly answer that and we'll just wrap up?
Okay, so normally menstrual blood, the menstrual flow blood does not clot because of the presence of certain substances in the menstrual fluid, which prevents the blood from clotting. Anytime the flow is heavier than that, that's when the blood tends to clot. So it's okay to have blood clots during menstruation as long as you're not bleeding very heavily and you're not becoming anemic from it. And of course, sometimes if there is a tendency for large clots, you may also find that the period is a little bit more painful. So per se, the presence of clots in your menstrual cycle is not abnormal, it's not wrong. But if it is causing you like significant pain, or it's, the bleeding is so heavy and you're becoming anemic from it, or it's causing a problem, then yes, then it needs to be checked.
Thank you so much, Dr. Uma. And just a reminder, tomorrow we are having another interesting session with Dr. Uma and other experts on breastfeeding. Last week was, the first week of August was World Breastfeeding Week, and so we are taking it up tomorrow to discuss on the importance of breastfeeding and other discussions and doubts that one may have on breastfeeding. And next week, Sunday, we are having a very interesting yoga session on menstrual health. It's a very, I would say, a mellow, calming session by Mr. Ravi and Sheila. They are experts in women's health, especially for yoga. So if you or your friend, you have migraines or menstrual cramps or any other discomfort during menstruation, this yoga session, I'm sure, will really help you. So do register for these two sessions on insider.com. So see you all very soon. Thank you once again for your time. Bye-bye.
Thank you for having us. Thank you.
Thank you, Shruti. Thank you, other panelists.
Thanks, Shruti. Thanks, everybody. It was a lovely session. Thank you.
Thank you.
Thank you.